Hi there, I'm Kurt Jimwell Resuelo, a clinical clerk from the Cebu Institute of Medicine in the Philippines, and welcome back to my channel. So for this video, I'll be showing you how to do a simple interrupted suturing technique. Whether it's this type of wound or this type of wound, this technique can help you. Suturing is very important to help the wounds close, prevent infection, and ultimately help you heal faster. But wait. Before you start suturing someone up, that's pretty painful. So to begin, I'll first be showing you how to apply local anesthesia. Infiltration of local anesthesia. Materials needed: a syringe and an anesthetic of choice. Step 1. Aspirate anesthetic from the bottle while observing sterility and safety. Remember, the anesthetic bottle is considered unsterile, so be careful not to touch it with your gloved hand. For the dosage, compute for the safe dosage you can give to the patient. This depends on the anesthetic of choice. Step 2. Removal of air from the syringe. Step 3. Inject the local anesthetic with the bevel up at the desired area subcutaneously. Always remember to aspirate before injection of contents to make sure to not hit any subcutaneous vessels. You'll know when a vessel is hit when there is a backflow of blood in the syringe. Step 4. Check the effects of the anesthetic using the tip of the needle. This has an onset of around 2 minutes. So at this point, you have to ask the patient, "Ma'am, sir, does this hurt? Do you feel this?" Once the effects have set in, it's time to suture. So now that the anesthetic effect has set in, it's time to start suturing. Let's go! Simple Interrupted Suturing Technique. Materials needed: needle holder, suture, suturing scissors, pickup forceps, and a suturing pad or an alternative. Before we begin, you need to know how to properly handle the needle holder and the pickup forceps. For the needle holder, hold it with the ring finger and thumb of your dominant hand in a prone position, while the other hand will hold the pickup forceps with a pencil grip. Next is a proper loading of the needle. Use the pickup forceps with one hand to hold the needle. Position the needle at the tip of the needle holder. The needle is held 2/3 midway of the needle. Start suturing by approaching one side with the needle about 1 cm from the edge perpendicular to the tissue sutured. Gentle rotation of the wrist following the arc of the needle subsequently follows until the suture exits the other surface. Then the length of the suture is adjusted. Next, perform an instrument tie or a square knot. Ensure that the knot is tightly done in order to achieve wound approximation. Grab your suturing scissors and handle them just like how you do it with your needle holder. Hold it with the ring finger and thumb of your dominant hand in a prone position. Cut the suture 1 cm from the knot. The whole procedure is repeated along the entire length of the wound. Lastly, test the strength of the suture. All done!
And that's it. I hope I helped you guys learn a thing or two about suturing, and may you hopefully use it in the future. Hopefully not, because it's pretty bad if you get a wound. But yes, so if you like this video, please like it, subscribe, share it with your friends, leave a comment down below if you like it, or if you want me to do any more videos like this. I don't know why. Thank you, that's it, and bye!